They say clothes make the man or the woman. What if tumors did the same thing? If tumors, cancer cells dressed up to make themselves even stronger. We're going to talk about how tumors dress up, called the tumor microenvironment.
Always blame the stroma, the tumor microenvironment, this dense, fibrous nest of tissue that doesn't have cancer cells but seems to wrap itself around the cancer, almost in a way that it's protecting the cancer from the outside forces, from the body's immune system, from the chemo medications that we're giving it.
I kind of think of it as like its little home that keeps it protected, right? Just like our home keeps us protected, except we don't like that home because there's cancer inside.
Looking at all prongs, all ways to attack
Yeah.
cancer at all time. It's a busy city. As I said in the beginning, the clothes
busy
makes the man and the women. And so I think it's important to understand the cloaking devices, the clothing that tumors wear, and to the extreme, rock the mic like a vandal. It's like, the ability of cancer cells to subvert its environment. So we know that
a lot of clickbaits, and we have a lot of, the word inflammation means something online, and, people trying to reduce inflammation. But we're sitting here talking about how we're trying to make something more inflamed because it will respond to cancer treatment better. And so it just kind of came to me that that's a really interesting thing.
Whether it's determining whether someone's tumor is operable and if the surgeon can take out all of the margins of the tumor and leave enough normal tissue behind, the stroma makes imaging the tumor extremely difficult. I believe oftentimes we end up over-treating people with chemotherapy and over-treating them sometimes with even radiation.
they say clothes make the man or the woman. What if tumors did the same thing? If tumors, cancer cells dressed up to make themselves even stronger. We're going to talk about how tumors dress up. It's called the tumor microenvironment. How tumors recraft themselves and evolve over time is a real mystery that hasn't been addressed so much in how we drug cancer in therapeutics. But we're here to talk about that today and kind of demystify the mystery of it. What do you guys think about when you hear the term tumor microenvironment?
I've been working in the pancreatic cancer space for close to 15 years, and we always blame the stroma, the tumor microenvironment, this dense, fibrous nest of tissue that doesn't have cancer cells but seems to wrap itself around the cancer, almost in a way that it's protecting the cancer from the outside forces, from the body's immune system, from the chemo medications that we're giving it. And if only we could crack that nest, crack that shell, our treatments can get in and the treatments can start working and we can start making a big difference. But the more treatments that we've been doing, even treatments that have been targeting the stroma specifically, they just haven't led to better results. So I don't really know where we stand right now.
I kind of think of it as like its little home that keeps it protected, right? Just like our home keeps us protected, except we don't like that home because there's cancer inside. So that's kind of what I think of the tumor microenvironment. I got to say that I think we frequently blame the tumor microenvironment for drugs not working. But beyond that, it's like so much more complicated than just, oh, it's just not working because of the tumor microenvironment. Because there's like so many things in the tumor microenvironment. And so I'm actually really excited we're going to talk about it because I think it's kind of like sometimes we use it as like a vague, like, the tumor microenvironment, like, just like the like, it's like almost like hand wavy. And so I'm like really excited to dive into like the details of it.
Yeah, I talked earlier about clothing and then thinking about fashion. And when I think about fashion, I think about New York City and Paris and London, of course. But these are busy cities. When I give presentations, I like to show kind of the hustle and bustle of cities. And I just say that there are people walking on the sidewalk. There are cabs. There are skyways connecting buildings. And there's a lot of stuff going around. And there's a lot of components of any city, big and small. And tumors are no different. And so when we think of biopsies, when we think of surgeries, and even here as doctors, we know that there's a slide it's a two-dimensional representation of that city, which is a tumor, and it's a snapshot in time. But it's a snapshot in time for something that's constantly dynamic and ever evolving. And so what we have to realize is how tumors are constantly changing. And so it's trying to hit a moving target. We're not always successful at that. As drugs have been designed to try and hit the cancer cells, what we're forgetting is that shell, the clothing that makes that tumor. What are examples that you guys have heard of or are anticipating to hear at the ASCO annual meeting this year that you think can more effectively hit that target, the stroma target?
Well, let me tell you why I'm skeptical. If we rewind to ASCO from a few years ago, there was a medication that was supposed to target a specific factor within the tumor microenvironment, and it was supposed to weaken the stroma and allow the chemo medications to go in. And lo and behold, the study ended up being discontinued early because the people who were getting the experimental drug had worse outcome compared to the people who weren't. So it turned out that maybe in some way, that specific molecule that was being targeted in that treatment and that component of the stroma was actually containing the cancer. And it wasn't only feeding the cancer, but it was actually containing the cancer. And when we busted that part of the stroma, the cancer started to metastasize even more. So I have an objection with the whole concept of the tumor microenvironment because I don't think it's one specific thing, and it's actually an environment which is interacting with the tumor, interacting with the host, and has good parts, and it has other parts which are detrimental for our outcomes as well. So seeing all the new treatments that are coming out in this space is making it even more exciting in our understanding of the different cells that are present in the stroma and the different treatments that we can use to target those cells and change the milieu of the tumor microenvironment is getting better and better.
So the thing at ASCO actually that I'm really excited about is I think we're seeing a phase 1/2 study looking at T regulatory depleting cells. So I don't know if you guys all recall, but actually the people who discovered these cells just recently, I think, won the Nobel Prize. Am I correct? I think so. And essentially, in the tumor microenvironment, to exactly your point, Shalon, the tumor microenvironment has so many different components, right? And so it seems like obviously that one drug may have not worked and had worse outcomes, which is not great. But I do believe, the TLDR is that there's cells, in the tumor that are shielding the tumor from their immune cells that are shielding the tumor from your immune system. And this is a drug that goes and attacks and depletes those shield cells. And the idea is then your immune system, it's like open season and your immune system can go to town and kill the tumor cells. And so that's like one way that we're trying to use that Nobel Prize science to help cancer cancer cure. And I believe that I do know that there's a phase 1/2 study of a drug targeting CCR8 and depleting these T regulatory cells, which is part of the tumor microenvironment, so that we can go and attack the cancer cells. And so that's like one thing that I'm like looking forward to, that I hope, I'm a big believer in the T regulatory depleting technology. And so I'm really hoping that it's going to work out.
Yeah. So in this era of ask your doctor, is immunotherapy right for you? And it's not always correct, right? Some cancers more than others. But isn't it fascinating? It's not immunotherapy to activate something, it's to get rid of an immune therapy component that's cloaking, it's shielding, it's preventing the cancer from being attacked, whether it's by chemotherapy or others. And so those Treg cells, it's actually the therapeutic strategy is to deplete it, to take out something that's immune cells that
To take out
intuitively you would
immune
think it's
cells.
attacking, right? It's immune cells you would think be working against the cancer like it would work against infection, but it's not.
Yeah. I think that's like a really good like side note segue of like a lot of times, we see online strengthen the immune system, right? But the immune system is complicated AF. And I just feel like in the same way, right? T regulatory cells, our strategy in immunotherapy is to deplete these cells. And so saying like strengthening the immune system or having more immune cells, it's just not as simple as that.
To the extreme, rock the mic like a vandal. It's like the ability of cancer cells to subvert its environment. So we know that, and this has been targeted for over 20 years, right? The blood vessels that form by a tumor are not like regular blood vessels in our body. They're formed by the tumor to nourish itself. And so the same thing, to kind of subvert the immune system and to teach it to stand down basically and not attack the cancer is rather remarkable. And so that is something that I think being able to deplete that would really be a unique strategy. But I've had conversations. I have conversations with patients all the time. We start drugs, right, and they work until they don't work. And so that's in the case that they work at all. But maybe you get an interval scan at every few months, and you'll see tumors shrink of any kind, colorectal, pancreas, or others, and then maybe that will plateau after a few more months, and then it won't work anymore. So it's kind of that mystery that I think can be solved, at least in part, by understanding the tumor microenvironment. But we have to understand strategies that should we be changing things before it gets to that point, before it gets to the point where the tumor microenvironment pivots and it recrafts itself and kind of stands against the chemotherapy that's already being given. including the targeted therapies that are blocking the blood vessels from forming. Shalon, what's your take on that? Because I think I know the trial that you're referring to. I'm wondering if you're mentioning hyaluronidase when you mentioned that one, because that's kind of an infamous one in pancreas cancer from about a decade ago. But we just still need more of these strategies down the pipeline.
No, but I think the point that I want everyone to realize is when the discussion that both of you are having right now on the tumor microenvironment is actually just focusing on the immune cells. That's the only one component of the tumor stroma and the tumor microenvironment. And it's very dynamic because by design, our immune system has accelerators and brakes and checks and balances in there. So some cells are there and they're always on. Some cells are there and they're always off. And then you have like the moderator or the orchestrator that's deciding when to turn on which cell in which part of the body. And the best thing that we know right now about the checkpoint inhibitors and the immune therapy medications is the way they end up working is that they're able to direct these cells called cytotoxic T cells into the cancer. And those are the cells, that's the last step for where the immune system will and then lead to dead cells. So the Treg cells, Shruti, that you're describing are probably going to impart their anti-tumor effectiveness through the through the cytotoxic T cells. Now, there are other efforts out there to even image these cells while they are circulating in the body and to measure their quantity even in individual biopsies. So when we talk about the tumor microenvironment, all these different aspects that are around there, like I really want the conversation, and I'm very excited to see what we're going to hear at ASCO, but I want the conversation about which aspect of the tumor microenvironment are we framing, because that phrase means very different things to each one of us.
I was just going to say, I think to your point about like the multiple different kinds, right? You have in pancreatic cancer, you have high interstitial pressure because of the like stroma, and drugs can't get in as well, which is an entirely different thing than the immune system keeping the immune cells out, right? So it's like an interplay that, to your point, like tumor microenvironment, it's so many different things that we have to target, right? It's dense fibrosis and tissue and stroma, and then there's also these immune cells that are trying to keep the good killing cancer cell, the good killing immune cells out of the tumor. And so it's so many different things that we have to be focusing on. It's just, but again, like I said earlier in the episode, I feel like we hand wave the tumor microenvironment. It's just like this big thing, Yeah, exactly.
Message. It's not just cancer cells. And they're remarkably, when you look at the proportion, what part of a tumor out of a whole, out of 100% tumor is cancer. In cancers tumors as a whole, if more than half of it is not composed of cancer cells, it's the stroma stuff, the immune cells that aren't working, like the Tregs that Shruti, you were mentioning, the blood vessel part, and all the scaffold of the house, so to speak, the clothes that make the tumor. The more stroma there is, it's associated with a worse prognosis and a more resistance to chemotherapy and kind of a worse cancer overall. And something I'm looking forward to hearing about in more months to come, and something we've been hearing a little bit in the past years, but I think at the tip of the iceberg is converting tumors from cold to hot. And so the reason we use that terminology is that hot means inflamed. A lot of the immune system has been awakened. It's been restored in a way that's more susceptible to immunotherapy. And so getting that, as I said earlier in the episode, somewhat tongue-in-cheek, how to ask your doctor if immunotherapy is right for you. There are ways to convert. It's being explored how to convert tumors, and whether it's in where it started or where it spread in different parts of the body may make a difference, but also the markers like microsatellite instability, that's only in a small minority of patients across many cancers. But if there's a way to do a drug to convert it, not just being hot, but to change the DNA of it that makes it more susceptible to immunotherapy, really hot area. And I'm really looking forward to seeing what will happen in the months and years to come in that arena.
I was going to make a comment about you saying the word inflamed because I find it so interesting that so much of I've been reading a lot about GLP-1s recently, making a lot of posts about GLP-1s because there's like 42 abstracts at ASCO about GLP-1s. And of course, so much of what everybody's talking about is metabolic syndrome, inflammation. And it's so interesting, right? Because we're saying we need to reduce inflammation so that there's like reduced cancer recurrence risk or reduced cancer risk in general in healthy people. But then in this specific situation with immunotherapy, we are trying to make the tumor more inflamed. And so it's just another kind of reminder to me that words have a lot of meaning in them and can mean multiple things. And so when we have a lot of clickbaits and we have a lot of, the word inflammation means something online and people trying to reduce inflammation, but we're sitting here talking about how we're trying to make something more inflamed because it will respond to cancer treatment better. And so it just kind of came to me that that's a really interesting thing.
Yeah,
Yeah,
when we talk about
quality and quantity.
inflammation, we're saying that we're sending the immune cells to that area to cause inflammation, and that's how they're going to impart their anti-tumor effect. There's one case where I uniformly hate the stroma, and that's when we talk about scanning the pancreatic tumors. Whether it's identifying pancreatic tumors early, whether it's determining whether someone's tumor is is operable, and if the surgeon can take out all of the margins of the tumor and leave enough normal tissue behind, the stroma makes imaging the tumor extremely difficult.
It
I
does.
believe oftentimes we end up over-treating people with chemotherapy and over-treating them sometimes with even radiation, or we end up preventing someone from going to surgery because we can't tell where the stroma ends and where the tumor begins. And that leads to certain complications in our decision making. And we all have been in the room when we're looking at scans and trying to determine where the tumor ends. And that's one area, again, when it comes to imaging modalities and with new AI tools, I'm excited to see how those can help differentiate stroma from the tumor and help us come up with a better margin calling for areas. So we can identify lesions earlier. Last episode, we talked about now we can even identify pancreatic tumors from non-contrast CTs. That's just absolutely absurd to use on what we're seeing that some of these AI tools can accomplish. So maybe these AI tools in imaging are actually able to differentiate the tumor from the stroma, and that's going to actually increase our ability to identify pancreatic cancers earlier, find the effectiveness of treatment, and identify the best people to go for surgery.
Nice. There's a lot of great things to come. You threw in GLP-1 agonists. That's I think a hot topic for 2026, and all of it's wrapped up in the tumor microenvironment. So I think it's good to talk through tumor microenvironment. It takes us back to cell biology, and sometimes we don't want to get too biology ridden, I guess, in our talk about clinical oncology and what makes a difference to patients. But I think it totally makes a difference to patients, and just to know about the science, remind ourselves about new research directions, what's coming down the pipeline is really going to be impacted by what we know about the biology. And as always, I'll always beat the drum for the importance of cancer research. And so that's no different now than ever. And then hopefully some of this discussion today has helped shed some more light on it, especially as we're turning the corner into conference season.
Emil, I was not looking forward to this little foray into cell biology, but you carried us really well, really brought some really important topics right now that are really relevant to people who are practicing oncology, who are looking at the new medications that are coming through, and the new innovation that's going to be announced in the next couple of weeks.
And for patients to like understand what the heck is happening in their bodies, because I think we're not gatekeeping science or research here, right? We just want people to understand what the heck is happening. And yeah, I was similarly not that excited to talk about the tumor environment, microenvironment, but I'm really glad we did.
I do want to
Well,
make one point. I think we spent so much time in the last few decades perseverating over the tumor microenvironment, over how we can disrupt the tumor microenvironment in pancreatic cancer and to get treatments in there. And if only we can crack the tumor microenvironment, we can get treatments better. But we talked about KRAS inhibitors in one of our previous episodes, and these are treatments
yeah.
that are working very well in pancreatic cancer, and no one seems to be cared. They seem to have overcome any impact that the stroma had. So somehow those medications are making their way through. So I feel a lot of our efforts for targeting the tumor microenvironment and stroma were distracting us from focusing on the biology of the cancer itself, because now that we have effective treatments that are shrinking cancers up to 50% of the time, all of a sudden the stroma doesn't matter. The stroma is still there. So why isn't it?
Yeah.
Why is it letting these medications through? So I think there's a lot of work for us to do in that space, and that just is like another reason why I don't really care too much about the tumor microenvironment,
I
other
hope I
than the
gained
fact
two
that
converts today.
I gotta say, I'm sipping the tumor microenvironment Kool-Aid only because not everything is targetable. That's just
Yeah.
the facts. Not everything
Yeah.
is targetable. So if we can manipulate the cancer by affecting the tumor microenvironment, it's just another tool. That's all
Yeah.
I'll say.
Looking at all prongs, all ways to attack
Yeah.
cancer at all time. It's a busy city. As I said in the beginning,
It's
the
busy.
clothes makes the man and the women, and so like I think it's important to understand the cloaking devices, the clothing that tumors wear, and I hope the discussion was helpful. Thanks for everybody for joining.